Guys, I'm Coco Chan, and today I'll be talking about HIV and how it affects or relates to public health. 1. Public health problem. Why does this problem exist in our society? Every year, people die because of HIV. In the year of 2015, about 36.7 million people were living with HIV and resulted in 1.1 million deaths. Most of the affected or infected live in sub-Saharan Africa, but HIV has taken a total of 39 million deaths worldwide. 2. How did this happen? HIV is spread through direct contact with certain body fluids from someone that is already infected, such as through blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk. All of these body fluids can come in contact by direct injection into the bloodstream, and that is how HIV is spread. Where did this happen? HIV originated from chimpanzees, and somehow the virus crossed species from chimps to humans somewhere down the line, and people are speculating that it has developed or came from the Democratic Republic of Congo. 4. What are the risks for the community in the future? I think the optimistic trend is a downward rate of HIV transmission rate, and in 10 years, the goal is to see the decline of HIV by 24%. Continuing about the public health problem. Number 5, what are or were the etiological factors? Anyone is at risk. There is no such thing as, oh, this person will have it more or this person will have a lesser risk. But the most risk is men who have sex with men, injection drug users, women, ethnic minorities, youth people, younger people, and older people. And on the right side, I have a chart right over here. It is a circle graph that says the diagnosis of HIV infection among adults and adolescents by transmissions in the year 2010. So you can see right here is 61% is male-to-male sexual contact. The second biggest one is hetero contact, then injection drug use, which is by 8%. And third, the 3% is male-to-male sexual use and injection drug use, and the less than 1% is the others. So you can see that anyone is at risk and no one is in particular not at risk. Number 2, how to solve the public health problem. I have 2 strategies. There are definitely way more, but the strategy 1 is there is no specific cure for HIV, yet however, there is treatment that can control HIV from allowing people to live a long and healthy life. So there is treatments out there that can help control it, help tame it, so that people can still live long and healthy life. Strategy 2, using condoms correctly. Do not inject drugs, and if you do inject drugs, make sure to only use sterile injection equipment and get tested regularly. Often you cannot tell if you have HIVs until years or months because the symptoms may not be very visible. So getting tested regularly would definitely help solve or even help control the HIV problem in our society, and also correct use of condoms. Continuing, I have 2 cultural examples. The first one is voluntary medical male circumcision. Male circumcision reduces the risk of sexual transmission of HIV by 60%, which is very high. Another example that I have is also cultural. It is increase on condom usage. Poverty, limited information on HIV, and education leads to the decrease of condom use across sub-Saharan Africa. So if we increase the information and increase the education on HIV, more people will be used to using condoms versus being more against it. They will be more for it. And public health in the future. What should be done to prevent the reoccurrence of this problem? I think it's very important to practice safe sex by using condoms. We can definitely decrease the number of cases of HIV. I know I've talked about using condoms a lot, but by using it correctly, we can definitely decrease the number of people that are affected by HIV. Also, by using only clean and sterile equipment when injecting drugs, we can dramatically prevent this public health problem. I think a lot of people are more reckless and they do not think before they take an action, and because of that, a lot of us are affected or infected by HIV. And once you have it, it's not something that can just be easily taken care of, and it will be a lifelong journey to get used to it. And in my opinion, HIV will probably still be around for many years to come. But with our modern day technology and knowledge, we can find treatments to temporarily solve the problem. I do not think that just by taking steps like this, it will help. Ultimately, I think finding a cure for HIV is the only cure and the only thing that can help us.